So at Skoll, we invest in social entrepreneurs, people who see a problem, design an innovation to create systemic change to solve that problem. And they look at a challenge that others would walk away from and see an opportunity to make a difference in the world. I'm very fortunate to be on the stage today with my four first awardees as the new head of the Skoll Foundation, who were selected from around the world for their ideas for how to create systemic change in the innovations that they've created. I'm not going to go into detail into their bios because they're all in your app and in the books, but I do want to give a quick intro to each of them. Julie Cordua is the CEO of Thorn. Thorn defends children from sexual abuse by leveraging the power of technology, scouring data from across the web using smart algorithms and working with law enforcement to find child victims. Today, Thorn's programs are deployed in 30 countries, have reached more than 3 million people, and have helped identify more than 30,000 victims of abuse. Greg, seated next to her, wave so everybody knows who you are, is co-founder and CEO of mPharma. Greg had the idea that to reinvent healthcare delivery in Africa through the pharmacy. The pharmacy is in every community. How do you utilize that as a vehicle for changing healthcare across the continent? They've done that incredibly successfully, working with a network of over 243 pharmacies. They've reduced the cost of drugs in Africa in the places they work by 30, 40%? What's the right number?
Around that.
30 or 40%. They're coming up with innovative solutions to help people buy those drugs. And it's truly a remarkable change in how healthcare can be transformed on the continent. Nancy is the co-founder and CEO of Crisis Textline. Wave. Crisis Textline has built a 24/7 mental health support service that reaches people all across now the US and UK?
And Canada.
And Canada. And serving underserved demographics, but serving everyone with mental health issues. They processed more than 100 million messages to date in the US, conducting more than over 4,000 conversations every day, really helping people who are in crisis sort through their lives. And they've also used AI and data technology to identify and figure out where are the most severe cases, stack rank them, and they're building a database that helps community providers figure out what are interventions to help solve this. Finally, Bright, raise your hand. Bright is the president of Impedigree. Impedigree fights drug and agricultural seed counterfeiting using a small marker on all the products that is now working in over 3 continents in partnerships with governments, Fortune 500 companies, grassroots organizations. And not only does this improve health and food security, but it fights corruption, which has been rising all around the world, an incredibly innovative technology. So I'm really excited to have this group, and I'm going to ask them some questions, but then I hope you all will be ready to ask some questions yourselves as they'll be walking around with microphones a little bit later. So with that, let me start with, where did you get the idea for your innovation? And what was the inspiration behind it? Julie, kick off.
Sure. So about 8 years ago, I joined our founders to look at the role technology was playing in the sexual exploitation of children. And we were looking at the buying and selling of children online for sex, child sex trafficking, as well as the spread of child sexual abuse imagery, or what is legally called child pornography, but we don't use that term. And we started realizing that technology had basically, I use the word democratized, and often that's used in a positive way to say more people have access to things. Well, in this world, more people have access to the abuse of children through technology. And you were seeing the volumes of victims dramatically increase, the number of people participating because they could hide behind computer screens dramatically increase. And the use of technology as a tool to counteract that hadn't been deployed. There was not a lot of money to be made, and law enforcement, who's on the front lines of it, that's not a place you see a lot of technology innovation. And so you just saw perpetrators be able to completely deploy new technologies to abuse kids. And all of those on the front lines who were dealing with the aftermath of that didn't have the tools to kind of counteract that. And so we started 8 years ago, and we said, well, we'll focus on driving technology innovation in this space. And we really thought we would kind of be a think tank or a innovation hub. And we built our first product, which was in trafficking. And we went to the FBI and we said, hey, we've built this tool, it's working, it's helping to find child sex trafficking victims faster. Why don't you deploy it, take it on, we'll donate it. And they said, well, no, we don't know how to deploy a system like that. And that long story, but we then realized we would have to become a product organization. So we actually now, we're a nonprofit, but we look very much like a technology product company. That was our first product that's now deployed, identifying child sex trafficking victims across the US and Canada. But then we were about 3 years in, and we got a phone call to help from Department of Homeland Security, asking us to help them on a dark web case of a little girl in child...
You're fine.
in child sexual abuse imagery. And we hadn't worked in that space because that content is illegal. So it is very difficult for innovators to work on illegal content. But we saw very quickly that these children in these images, and we went to basically the darkest parts of the internet. And it is a huge market, the trade of child sexual abuse material. And we saw how quickly technology could transform the response in that space, but it had been neglected because it is a dark topic and it is illegal content. But we had seen it, and so that's where we went. And we now have built the systems to identify children in the dark web with law enforcement faster. And we are now deploying the systems for the private sector companies to identify, remove, and report this content at scale globally. So we are not on the front lines. We see ourselves as the enabler to connect the dots and build the technology systems that should have been built 10, 15 years ago for these kids to transform our global response to online child sexual abuse material.
Greg, you ready to follow that one up?
Sorry, I always cry.
I've heard her do this 4 times, and it's...
It never stops.
And I always sit next to Julie. So it's like, it's just hard.
I'm sorry. Put me at the end next time.
Yeah, next time. We should learn that, but we're slow learners.
So in 2013, I was living in San Francisco. And I remember it was one morning when I got an email from a friend, and it was an article that CNN had just published about a drug company in India called Ranbaxy. Actually, Ranbaxy is was one of the largest suppliers of generic Lipitor in the U.S. And in that article, it was pretty much sort of revealing the fraud and corruption that the company had been concealing as they sort of supplied all its drugs to the US and other countries. But long story short, there was a part of that article that really got to me. It was a conversation between one of the quality assurance managers and a senior commercial executive about a batch of ARV drugs that were just about to be shipped to Africa. And they had just done some quality tests on these drugs, and they realized that the drugs were not good. They did not have the shelf life and the full active ingredients in them. So she recommended that they do not ship them to Africa. And the commercial manager said, well, they have to do it. It's Africa. It's just black people dying. No one cares. And obviously, I'm a black person. And I'm from Africa. So that sentence for me was what spurred my interest in really beginning to understand how can we build new systems and new solutions that can guarantee the access to high quality medicines for patients on the continent. So I moved back with my co-founders, and we realized that the pharmacy, as Don had mentioned, is the most visited space in the healthcare sector, even in the US. We go to the pharmacy more than we go to the doctor. Like we go to the pharmacy to buy shampoo, right? But when you go into a pharmacy, you're in a healthcare space. So for us, the question was, how do we take the space that people are going to and help them become more proactive about their health? And how do we leverage the scale that we can aggregate based on all these pharmacies that we can put together to begin to drive down drug prices? And that is sort of what we've been doing for the last 5 years, where today we work in 5 African countries, serve over 70,000 patients each month, and helping drive down costs, but also leveraging the pharmacy to deliver primary health care to patients that live in the communities that we serve.
Great. Nancy?
I was the CEO of DoSomething.org, which is the largest organization for young people in America. It's about 6 million members. That's bigger than the Boy Scouts and Girl Scouts combined. It's bigger than the NRA. It's a very large organization. The reason why it's so big is because it's all by text. So young people texting with Do Something texting with them. Every week, a different thing that they can do that doesn't require money, an adult, or a car. And so because of that, because it was text, and you really only text with your family and your friends and do something, people felt close to do something. And so we would send out a campaign about collecting peanut butter for food pantries, or Teens for Jeans, collecting blue jeans for kids in homeless shelters. And it would be great. You get about 200,000 kids doing each campaign, filling the nation's pantries with peanut butter. By the way, 2/3 of the country is smooth, not crunchy, but that's another story. But then we would also get messages back, because they felt close to us, having nothing to do with peanut butter, but things like, I'm being bullied and I don't want to go to school. My best friend is addicted to crystal meth. What should I do? And we would send back like, hey, here's a good hotline, or maybe you should talk to your school principal. And then we got a message that said exactly this. We should have given you a trigger warning before this session, by the way. I think that they split us up on purpose. He won't stop raping me. It's my dad. He told me not to tell anyone. And the letters RUT, which mean, are you there? And one of my employees brought it in and put it on the desk in front of me and was like, I don't know what to do with this message. And we sent back the phone number for RAIN, the Rape and Incest Organization in DC. They're terrific. Didn't hear back. I came back the next day and was like, did we hear back from her? Never heard back from her. This August, it'll be 8 years, actually, since that message. And in that time, I have tried to call that phone number, text that phone number. I don't know if it was a burner phone. I don't know if her dad saw the message. I don't know if she's dead or alive. And about a year ago, one of my employees said to me, you always use a female pronoun, and you don't know that that was a girl. So within 2 weeks of getting that message, I was like, look, they keep sending us this stuff. They are desperate and alone, and they want to text these things. Someone needs to start a hotline by text. And so we started a hotline by text, and I eventually left Do Something and am now just full-time at Crisis Text Line. And as Don said, there's a lot of pain in America. We've processed about 110 million messages in less than 6 years. We've launched in Canada, in the UK, and the goal is to do 13 countries in the next 3 years. 13 more countries.
right? You get to back cleanup here.
Yes. So in my case, I had been an activist since my teenage years. In Ghana, the student movement is much more radical than in the US. So when I relocated to Europe, I naturally was drawn to activism. And I joined the migrants' rights movements. These were the days when refugees was a big topic and how to ensure that asylum claimants could be better processed and stuff like that. But then something happened to me on a personal level that changed the course of my life. I had a skin condition that convinced me that it was perhaps, because I had left Africa and gone to Europe, that it had something to do with a diet. Somebody advised me to shift to organic food. And funny enough, or rather, not funny enough, but rather, it was a good thing that happened, which is that all of a sudden, these skin conditions started to tone down. The question that came to mind, though, was that every time I would go to a supermarket to buy this organic food, the only reason why I'll be confident that I was getting organic food was because there was a seal on the packaging that said this was organic. Then I began to wonder, what if there was a way through which farmers in Africa who already grow this food organically, typically because they don't have the resources to buy the chemicals and the rest of it, could sell their food as organic. They could make more money, it will save the planet, and consumers in the West will benefit. To cut a long story short, the path that led me eventually to MPed degree was rooted in failure. Failure in the sense that this model that we had in mind of getting farmers in Africa to sell their fruits and vegetables as organic in Europe and America could not work. It could not work because we spent all our time building technology and trying to get supermarkets and regulators on board, but we never talked to any farmers until too late. So when eventually I relocated back to Ghana to try and mobilize the farmers, I had no understanding of the trust that was going to be required for them to fundamentally transform the way that they produce to suit this new model that we had in mind of using technology so that consumers, when you get your fruit or your vegetable, can go online and see which farm it came from. And if you enjoy the fruit or the vegetable, you could even tip the farmer. So the idea sounded brilliant, but you needed the farmers on board. They needed to change their system. They needed to apply these tags. They needed to pull their produce together so that it could be exported, etc. And we had completely underestimated the key beneficiaries, which were the farmers. But in the course of about giving up, a documentary was played on BBC about an incident in Nigeria where about 100 young people, infants actually, had died because somebody had produced teething medicine, this medicine that you give to children when they're about to develop teeth. They start having these fevers, so you have to give them this pediatric medicine. And somebody had decided to put in antifreeze, the same stuff that you put in refrigerators, because it was cheaper than buying centrifuges. So when you make these mixtures, if you don't use good centrifuges, they settle on the bottom. Because they were faking the product, they needed to make sure it looked as genuine as possible. But they were not willing to make the investments that were required. So they put in antifreeze, and about 100 infants who took this product died. So the BBC then went into a deep dive into this problem of counterfeit medicines around the world. I had no idea this problem even existed. It turned out that at least a fifth of all the medicines that were being sold in these parts of the world were fake. And in a place like Guinea, it was as bad as 60%. So literally, you walk into a pharmacy to buy malaria medicine for your child as a mother, and what will happen eventually is that you give the product to the child. And if you're very lucky, they don't get well. If you're unlucky, then the product has poisons, and therefore the child dies. You accelerate the mortality. We thought that the problem that we had initially tried to solve, this organic certification process, was very similar to this, just disguised. Fundamentally, the issue was trust. How do I, as a consumer, or as a farmer, or whatever it is, whatever capacity that I am in, when I pick up a product that means something, whether it's medicine or a seed, how do I tell that this is genuine? So long story short, we decided then to invest in a solution that enables the consumer or the farmer, in the case of seeds or other products like that, to be able to determine at the point of sale whether the product is indeed genuine.
And you do that how?
We do that now.
How do you do it? Tell everybody the...
So what we do is that we partner with the regulators. So in the US, that would be the FDA. We partner with technology companies like telecom companies, and we create a unique hotline. So think of it like a 911. But it's a 911 to verify your product. And when you see the product, you see a unique ID on it. and you're able to send it on your mobile phone. Either you scan it or you text it, either way to work. So it works for both smartphones and feature phones. And then it goes to this number, and you get a response back in a few seconds confirming that the product has gone through all the stages. Obviously, the system is designed such that you cannot copy that code, because otherwise it would be useless. So each code is cryptographically secure. And that is really the insight.
So, you know, what's so fascinating is each of them has come up with a design that incorporates the understanding of the societal problem with technology to move things forward. I'd love to hear, first of all, this is my last question, so you all start thinking of your questions. I'd love to hear from each of you sort of where you'd like to be in 5 years, what's your vision, and what do you need to get there? And who wants to go first?
Nancy? You're the leader.
Right, you're paying for dinner. Well, like I said, we want to be in more like 15, 16 countries in the next 3 or 4 years to have a global map, a real-time map of what's going on. So if you go to crisistrends.org, TRENDS.org, you'll see that we've aggregated and anonymized all the data and put it there, and it updates about every 30 seconds. So you can see real time what's going on in America. By the way, that it syncs exactly with what the CDC has published and what people, I don't know if you saw a study last week that suicide rates are up 33% since 1999, but their data ended in 2017. We have up to the minute data. So, and it's showing the same kinds of terrible trends. But you can see, anybody else here from Connecticut? I'm originally from Connecticut. #1 anxiety state. Anybody here Montana? Montana, have a house in Montana? #1 suicidal ideation. I mean, all of this, or do you want to guess the worst time of day for substance abuse? Anyone? By far? It's about 6 a.m., by far. Exactly. So we're sort of busting myths with the data. This is how we use the data to make other people better. I'm really excited to have a global real-time map that's based on fact. Right now, if you were going to have a global map of mental and behavioral health, it would have like 30 different asterisks on the bottom. This country's data as of 2017. This country defines a legal adult as age 13. And so there's not really such thing as domestic violence or rape because they're legally married and they can do what they want. This country doesn't have a definition of domestic violence, et cetera, et cetera. And so if we have a global map, this is an example of algorithms actually paving the way. That basically we would have an apples to apples real-time map of what's going on around the world. That's super exciting to me. And the second thing that's super exciting to me is just the delivery of the service itself, obviously. A lot of countries don't have mental health systems, or they don't have mental health systems that reach everyone. We skew young, poor, rural, and diverse. So 75% of the people who text us are under the age of 25. Some of you are parents, grandparents, siblings. The most shocking thing about the age that we reach is right now about 15% of our texters are under the age of 13. So there's a lot of middle school pain. They don't even all have phones. And one of the top issues we see, 20% of those kids say they're self-harming, they're cutting. And you don't see it because it's covered in long sleeves and jeans, but middle school is really rough right now in America. Poor, if you take the nation by socioeconomic status, the poorest 10% area codes, they're using 19% of our volume, so we double over-index the poorest people in America. And diverse, 19% of our texters are Hispanic, 12% Black, 5.5% Native American, which is really amazing. And there are just no services for Native Americans, so we really are their lifeline. I'm excited to bring this to countries where there's no culture. We're about to launch in Ireland in a few weeks. There's not a big culture of talking and about your emotions or having like a family therapist. So we're going to be a lifeline, I think. 66% of people who text with us tell us they've shared something with us they've never shared with another human being. I'm excited to bring that to the world.
And by the way, they do it with volunteers.
That's the other thing. So there's really 3 things that we do in a disruptive way. 1 is the technology itself. 2 is the data, which you mentioned in your intro. We stack rank the queue based on severity, like a hospital emergency room. So we use algorithms to figure out, based on language, who is at imminent risk. We might know even before you know. and then we make you number one in the queue. And the third thing is it's one of the largest distributed networks of volunteers in the world. So we've trained 22,000 everyday people to be crisis counselors. You apply online, go through a background check, and about a 34-hour training. And if you pass, and it's easier to get into most colleges in America than pass our training, but if you pass, you can do this at home in your jammies. For the most part, if you want to volunteer in America, you have to live in a city and be available during business hours, unless you want to be a Wikipedian or a crisis counselor with Crisis Text Line. And so we have stay-at-home moms, veterans, rural people, people who are not mobile, students who are crisis counselors, saving lives every day from their couch, while eating Doritos.
So she'll be taking sign-ups later.
Oh, no, do it online. You can go and you can apply right now. By the way, I will say also my favorite volunteers, seeing the audience, there are some of you here, my favorite volunteers, we have 36 people over the age of 70. So I'm just putting out there, there's no such thing as being too old to be a volunteer. We love you. You're some of our best volunteers.
Right.
I'm looking at a couple of you.
Your vision. Your vision for the next 5 years.
So when I talked about counterfeits, obviously it made it look like this was an isolated problem somewhere in the world, on the fringes of the world. And yes, counterfeits is a big problem, but the problem more generally is trust. So how many of you here have bought a herbal supplement in your lives before? Herbal supplement?
Herbal supplement.
Nutraceutical of some kind.
Herbal.
Okay, herbal, sorry. That's what will surprise most of you to learn is that when we've actually tested the most popular herbal supplements in these pharmacies, Walgreens, CVS, and the rest of it, only 21% of them have any plants in them, plant DNA, in the US. In fact, for Walmart, it was 4%. So if a herbal supplement has no plants, then what's in them? The problem of consumer trust is a universal problem. And I believe strongly that we would not have achieved our goal until we created a situation where every consumer, when you pick up any product, with a single scan or a single text message, should be able to get the best available information about the quality of that product, full stop. That is not achievable with current technology and with the current institutional arrangements. So our goal is obviously first to innovate on the technology. To give an example, if you take vaccines, it's not only the issue around whether the vaccine is coming from the right place or not, it's also how it was transported and stored. And if you don't refrigerate them within 2 degrees and 8 degrees, the vaccine stops conferring immunity. We're coming up with technology that enables a nurse with a single scan of a smart label to tell if that particular vaccine was well refrigerated. Because if it's not refrigerated, then you're going to give the MMRS vaccine to your child, but they're still going to get the measles. So not all the problems of the recurrence of disease that was supposed to extend are due to the fact that people are not vaccinating. People are vaccinating, but the quality of the vaccine is an issue. Our goal is to build the world's first global repository of quality information on every life-touching product conceivable, from cosmetics to nutraceuticals.
Very cool. That's awesome. Greg.
I was going to thank Julie.
No.
Reversing it now.
You go first.
I go first. I want mPharma to become the biggest healthcare provider in Africa. And we are doing that by building the largest network of community pharmacies. For me, success looks like this, really 4 things. One is that each community in Africa will have a pharmacy that is always well-stocked. No patient who walks into any of these pharmacies will be denied access to their prescription because of how much money they have in their pockets. These pharmacies will be transformed into community health centers. And finally, governments will begin to get out of the business of drug procurement and form partnerships with the private sector to manage the drug supply chain. A recent study from the Gates Foundation showed that in the public healthcare sector in Africa, when you go into a hospital, just about 29 to 50% of drugs will be available in the hospital pharmacy. Obviously, that is very wrong. In fact, I was recently in the Central African Republic a month ago, where, as most of you may know, CAR is one of the poorest nations in the world, has been in a civil war all its life, and just signed a ceasefire about a year ago. And the country is now thinking about how they rebuild. And they invited M-Pharma to come over to think about how we can actually take over building the country's drug supply chain and operate on behalf of the government for a couple of years. And for me, that is how big I want us to go, where governments begin to realize that the fact that their citizens would walk into hospitals and not have the drugs available is one of the greatest social injustice, and that they need to think about private sector partnerships to be able to address that issue. And that's what I hope we can do, starting with Central African Republic.
You can't make us all cry again.
I'm not. All right, very clear goal. We've set a 7 to 10 year goal to eliminate the trade of child sexual abuse material on the open web. We work on all layers of the internet, dark web, peer-to-peer, open web, but that is a very clear, measurable, achievable goal that we have outlined. Just to set the scope of that, it is the measurement of how much material is being traded right now on the open web is very difficult because not every country requires mandatory reporting when open web companies find it. The US is one of the only companies that has a law that says if a tech company finds this content on their platform, they must report it to the National Center for Missing and Exploited Children. Last year, more than 45 million images and videos of child sexual abuse were reported to the National Center for Missing and Exploited Children. Wow, that's a lot, but it was only from 12 companies, because those are really the only companies that have invested the $2 million or so it takes to build the content moderation platform required to find this material. So what we are doing is we've built a cloud-based system that lowers the cost for any company to participate in the moderation of this content down to thousands of dollars. And then all of the data that we learn from every time you find more images goes back into that system. And you start to get this exponential impact of more companies participating, more content being found, more content being pulled down. And because it's cloud-based, and because this is one of the only type of content in the world that is illegal, I think it's 170 countries that agree on the standards of child sexual abuse material, you can activate companies all around the world to pull it down. Our biggest challenges are motivating companies to do this. It isn't a, I don't believe companies have a malintent in not doing it. I think it never drives profit. Right? So if you're a startup company, even a mid-growth company, allocating money to stop the distribution of child rape on your platform is not where you focus. I would argue you should. We also are now encountering, you asked like what folks can do. One, advocate. I'm sure some of you are investors in companies. If you are investing in a company and that company all of a sudden gets a headline that they're one of the largest platforms that trade of child sexual abuse material, that's probably not very good for your investment. That's how MySpace went down. That's how I think Ask was one of their major problems. The other side of this is that we're pretty young, and so we've invested mostly in the technology development, but we are going to have to significantly invest moving forward in policy discussions. There is a big trade-off right now between privacy and safety. So for instance, Facebook is about to encrypt their entire messaging platform. Facebook is the #1 reporter of child sexual abuse material in the world right now. More than 5 million images and videos of child sexual abuse material were reported by Facebook by their own disclosure in Q1 of this year. Most of that on Messenger. When they encrypt, that goes dark. In those 5 million images were several children, not just several, thousands of children who are being abused today. We lose sight of all of that. Plus, people who want to trade now know where they can go for more. And I know there are millions of encrypted apps out there. I know this isn't a new thing, but this is painful to know what you know and then watch it go away. So when we are having discussions about privacy, I would advocate for more nuanced discussions about what privacy are we advocating for. These children do not have a voice. So because those of us who want privacy have a loud voice, we are neglecting the rights of the child for safety. I don't have an answer. I'm not standing here saying, well, this is how we solve for that. But I think we need to have a more advanced discussion about the trade-offs of privacy and safety. Because in a world where we don't believe the rape video of a 2-year-old should be viral content, when we decide to go encrypted and fully private, we are saying that is okay. So I'm going to leave you with that question and ask you all to help us advance the work we're doing, but also help advance the discussion and the work in this space.
So I think you can see why we at Skoll are so proud of all 4 of them. I'm going to open it up for questions now. If people can be very specific with their question and not give speeches, it would be great. And there are mic runners coming around. So here we got one right up front here.
Thanks for the work that you do. My question is for Nancy. I'm curious about with the reporting of trauma that may come through your system, do you capture incidents of microaggressions and racism? And then how do you address that? Because some of that stuff is more than just interpersonal. Yes. It's systemic. It's interactions with different systems and institutions. How do you capture that? What are you doing with it?
Yes, great question. So first of all, this is the largest mental health data set that's ever been collected, stored, and analyzed. We tag everything in real time. And so we have invited in researchers to look at our enclave data, so beyond what you're seeing on crisis trends. And we've already had 5 papers published, and there are another 10 coming in the next 12 months. And so we welcome researchers who want to come in. We haven't had anyone yet look at microaggressions. I would love someone to come in and look at microaggressions. Think of this as an unstructured data set, all sentiment, tagged by humans on both sides. So those of you who are in data and technology, like 19% of texters fill out a survey and 100% of crisis counselors fill out a survey, and it's matched. Let me go a level deeper specifically to talk about racism and institutional racism I also want to talk about, because there's something that I'm really passionate about that we're trying to figure out, and so if you're in this area, I'd love your help on this. But 30 times a day, which as you heard with over 4,000 conversations, is a tiny percentage of what we do. But 30 times a day, we need to call in what's called an active rescue. When someone has the plan, the means, and the timing to harm themselves, it's usually suicide, although 1 to 2 times a day it is homicide. We stop school shootings every day, mall bombings, and partner murder, 1 to 2 times a day. And so we call 911. We depend on 911. Does anybody here know how 911 is funded, by the way? Local landline taxes.
Oof.
Yeah, 911 is really in trouble in America, and we depend on it. I'm sure Julie depends on it. I'm sure every American depends on it. It is America's first responder. There are over 6,500 911 offices in America. It's hyper-local, totally fragmented. They all have their own software. When we call in an active rescue to 911, I'm very nervous about what happens when we call in an active rescue and a young black man opens the door. I'm very concerned when we call in 911, an active rescue to a neighborhood that's an immigrant neighborhood. Are they going to alert ICE? So we have been collecting data on these active rescues. How many of you have ever ordered a pizza from Domino's? Come on, you can admit it. Okay, like most of America has. Okay, or an insomnia cookie. So, yeah, thank you. All right, we're in Colorado. Definitely, there are people who do late night cookies in Colorado. Anyway, so we were like, why? Why do we know more about a pizza or a cookie than we know about an active rescue when we call one in? And so we built a pizza tracker. And so now our crisis counselors and our supervisors, who are paid full-time staff, see 911 has been contacted, your texter's been located, the texter's on the way. It's like a completion bar, and it's all time-stamped. We've done over 23,000 of these active rescues for suicide and homicide, and I have the data on all of these active rescues. Timestamps, locations, dispatchers. If you're a researcher in this space, come at me. Let's look at this and see what we can learn about 911, and about dispatching and about mental health in America. There's now a very rich data set that we can all get our hands in. You have to go through an IRB process. We're very concerned about privacy and safety. It's possible to do both, Facebook. So come at me, let's do it.
I have a question there and a question there. I'm not sure where our mics are. There, there, and there.
I can just yell.
Okay.
The four of you are doing really breakthrough things. I mean, huge ideas addressing enormous problems, and it takes big resources. And I think sometimes it can be misleading when you hear these big ideas to know the limited resources behind them. I'm curious what you all have to say about what it's going to take to really get to your goals in terms of human and financial capital, and ideas you have about how that's going to happen, or what the field needs to do to support that.
Not a plant, but a great question.
Oh, well, I'll just say quickly, and then I think
We'll ask them all to be quick so we can get another question.
I think philanthropic, I come from the private sector. This is the first nonprofit I've ever worked in, and I had to learn that you actually have to raise money for these things. But when thinking about philanthropy, a bit like venture funding would be, I think, a different way of thinking about it, and then challenging philanthropists to think about sustainable revenue streams on the backside of that. I don't think that you're going to possibly, in our area, for instance, there's not a lot of money to be made in building technologies to stop child sexual abuse, but I don't know that we'll ever be profitable, but I bet we could generate revenue from what we are doing. We're actually already starting to try. And so if philanthropists can invest in entrepreneurs, which Skoll does. We recently worked with the TED Audacious Project to help them break their ideas down into actionable plans. You fund that plan for the long term so that the resources of an organization aren't focused on kind of micro donations, but can be focused on the problem and solving it. And then you're challenging those entrepreneurs to think critically about what are the sustainable revenue streams, if there are in this field. They won't always be in some of these social issues, but in a lot of them there are. And I think philanthropists can start thinking differently and funders can start thinking differently in order to tackle big things at a big scale. And taking risks, be willing to take risks.
Right.
So that point about resource efficiency is very poignant. When we first made it possible for medicine to be tracked all the way from Belgium to the hands of a patient in Nigeria in 2010, the EU and the US have been trying to put into place systems similar like that, to that for about a decade and a half. We achieved that with 2% of the resources that have been dedicated for achieving the same thing in the EU. So it is entirely true that social entrepreneurs often are extremely resource efficient. The challenge that arises is that you need to do a lot of R&D, that even when you are a commercial enterprise and therefore you can recoup some of that investment through actual commercial sales, you still need someone to underwrite that R&D. And the world has not got to a place where they've recognized the power, in my mind, of social entrepreneurs and ability to utilize resources efficiently to transform the world. And so there's a lot of misallocation of resources due to the fact that nobody's recognizing that power. And I think that's the first thing we have to get out there, that social entrepreneurs are a global public resource, and that the ability to utilize resources efficiently to transform very complex problems is not being fully harnessed.
Greg or Nancy, you want to chime in?
I mean, I've always believed in market-based solutions to solving problems. M-Pharma has been revenue generating from day one, and we are not shy to say that we want to build a company that does good, but also is widely profitable in doing good. And so I think, our ability to sort of combine the potential to create extraordinary gains if we are widely successful and big, whilst also driving systemic change in underserved communities has sort of been the message, and it has helped us attract capital to be able to do the work that we've set out to do.
Philanthropy in America looks a lot like the making of a hot dog. It's not pretty. And I'm going to throw one out there, which is funders need to make harder choices. And I think you need to pick winners. Stop funding stupid competitive stuff. There are no market forces in the not-for-profit space to encourage M&A activity. You, as funders, are that market force. Force M&A activity. Shut stuff down that doesn't work. Pick winners. That's how you behave as for-profit investors. Why do you turn your brain off when you fund us? Be even tougher. And pick those winners and then put your chips on the table and go all in. But we don't need another cancer organization. I'm sorry that someone in your family, died and you want to do something to honor them, do it. Have a cancer organization that already exists, find a cure. Back something that already exists and help it win.
Okay, we got our last question up here because they keep flashing signs at me telling me how little time we have.
This is really dark, difficult, disturbing work that you do. Who takes care of you guys?
Oh.
Very good question.
We brought in mandatory mental health for our organization about 5 years ago. So we do, I guess it can't be mandatory in California, but highly encouraged monthly group sessions. We offer one-on-ones, and we have a culture of wellness. So we talk about it all the time. We've been given the language to talk about what we're feeling, and it usually presents itself not when you would expect it. Like I'll cry in a panel, not when I see an image. Thanks for bearing with me. But yeah, it's a process, and as I was deep in it 5-6 years ago. I'm not as much, but now I have 20 engineers and data scientists who all day are in the data. That's tough. So I have a high retention rate. We've never lost in 8 years an engineer or a data scientist because they are doing the work that they would give their life to do. But I know it's taking a toll. And so it's just something we have to be cognizant of and we have to invest in.
Okay, can I make a broader point, which is something we see at the Skoll Foundation all the time. Each of these social entrepreneurs has given up careers where they could have made more money, given up time to be with their families, because making this type of change is incredibly hard. And one of the sort of great realizations that the foundation had that I can't take credit for is connecting them to each other and to supporters to help them on this journey has been a big part of what we as a foundation try and do, because this work is hard and they keep pioneering ahead. It'll often at great personal and family sacrifice. And they just told me I have 0 minutes remaining. So let me say, all 4 of them will be around, as will I. So please find us, continue the conversation, and become part of changing the world through social entrepreneurs.